Good morning.
Good morning, Jim.
Jim Hunt, your Acting Director of Health Services, and Dr. Olivia Kasiri, our Health Officer. One of the things you asked us to report on this week was the status of the Epidemiology and Laboratory Capacity Grant. That's the $59 million that we were authorized shortly ago. Just Friday, the state conducted its first training webinar on allowable costs and submitting the plan. We are working on that, although there were still a number of significant questions that were not answered in that webinar. So we have nothing to report to you today on exactly what that plan looks like, and we hope to have that by our next report in 2 weeks. We're on top of it. We know how important it is, but we need to have the guidance. We need to make sure what we recommend is in line with what will be authorized and approved. So let's see what we got here. So you've seen this slide before, but the numbers have changed. This is based on the state's 7-day average, and it's actually a week behind. This is what will be updated today. And the numbers for today are 9.5 per 100,000, so we're getting closer to that 7 level. 3.8% for the positivity rate, and 5.8% for the equity positivity rate. So we're looking real good except for those cases per 100,000. Now you may have heard that the governor has proposed a change in that metric to go to 10 cases per 100,000. That will happen when the state hits 2 million doses administered to equity populations. We haven't reached that yet. And quite honestly, I think it's going to be a race as to whether we hit that first or whether we get our number down to 7 first. But within the next couple of weeks, I think we'll be there. So that looks very good. So let's talk about vaccines. Now this needs to be updated.
Excuse me, I'm sorry, Supervisor Desmond, excuse me.
Thank you, Madam Chair. Just on that, and specifically just to be clear, we would still need to stay, regardless of whether we meet the threshold at 8 or the 2 million, we still would have to be in that status for 2 weeks, or would it trigger us going to the red right away because of that new kind of metric?
They did clarify that, say, for example, if the state did hit the 2 million in the lowest quartile by next week, and therefore that would change the red tier threshold to 10 per 100,000. Since this week we are below the 10 per 100,000, if next week they have changed the threshold, then we would go straight into the red tier. So it could happen as early as next week or the following week. I guess we'll just have to keep monitoring.
Thank you. No, that clarification is important. Thank you.
Okay.
I don't know how you keep up with all these changes, by the way. I think you deserve an award just for that. Supervisor Cerna has a question.
Great, thank you. That's actually a good segue, Madam Chair. My question has to do generally with how our constituents are attempting to interpret messaging, different messaging that comes from both the Biden administration and the state administration. I think you're both well aware that I think it was last week or the week prior, President Biden announced that his objective is to see that every adult has access to vaccine by, I believe, the end of May. So how would someone that's generally concerned about acquiring a vaccination that perhaps doesn't qualify today because of age or occupation, how would someone reconcile what is being said in terms of a goal that the federal administration is saying versus where we are today, and then trying to figure out, okay, how do we get there? It seems to me that part of the frustrating exercise, quite frankly, over the last 12 months has been exactly that. Whether it's the Biden administration or the previous one, is trying to understand what does it all mean to me as a citizen of the country, a citizen of the state. Back then it was testing, now it's obviously vaccination. So maybe you can address that.
So the federal government makes the allocations to the state, but the state is the one that gives guidance as to who qualifies or and also how much each of the county gets. So right now, with the last update that they did, we are still, and I know that's one of the slides, the next slide that shows the different phases and tiers. That has changed over time as well. But right now we are still in phase 1B, tier 1. Starting next week, they will add the congregate settings with outbreaks. That will include the incarcerated and those experiencing homelessness, and also frontline essential workers. At the same time, they will also add persons aged 16 to 64 that have certain medical conditions that put them at risk. So that's a large increase. So a lot more people are going to be eligible in the next week or so. But the rate limiting factor will be the amount of vaccine.
And should we, unfortunately, if we should experience what we've experienced thus far with, I would, characterize to some degree as over-promising and under-providing, could we find ourselves in another bind where someone takes a look at that much more latitude for vaccine distribution and, makes the claim that, hey, I fall into those categories now, I should have access to vaccine. And are we going to continue to be faced with the challenge of saying, we understand that, but we just don't have it? That to me, that's kind of the essence of some of the, traffic that comes across my inbox, from constituents. And I'd really rather not have to spend a lot of time explaining, the nuance of that. So I think it's really important that we kind of, prepare for appropriate messaging if we find ourselves, again, conflicted because of what the guidance tells us versus what the availability really is.
Yes, and that's an important point you bring up, that being eligible doesn't mean that you automatically will have access to an appointment, because definitely the demand is much greater than the number of doses that we are getting. Our hope, especially with the promises that we're hearing at the federal government level, is that there will be a marked increase in the number of doses available, and that will assist with the demand.
Good. Well, I'm hopeful that, we can stay on top of the critical nuanced messaging as much as anything, because I think what you just said, Dr. Kasiri, is really important for people to understand.
Okay.
Thank you.
Thank you, Supervisor Cerna.
Just for your information, these are the conditions that the state has established would qualify folks that are 15 to 64 for vaccinations when we start that next week.
I also want to point out with this is that our hope is that many of them will be vaccinated by the healthcare provider.
Yes.
Because the healthcare provider will have the medical records. But we also do recognize that many people, their healthcare provider does not have access to the vaccine, or they don't have a healthcare provider, so we will still be able to vaccinate them. And we're working on that process to make it as low a barrier as possible. There have been discussions about how to make the verification, and we are actually going to do it by self-attestation.
Excuse me, Supervisor Desmond.
Yeah, I just want to clarify on the chart with who you're vaccinating now. Food and agriculture workers are included, right? So that was just a typo.
We started that.
Okay, I wanted to make sure.
Right. It's
yesterday.
because
Started them yesterday?
Yeah, it started yesterday. It's because this PowerPoint was put together last week, so we didn't get a chance to update it on the slide.
So there's been some question now that we've got the Johnson & Johnson vaccine of what's best. And the CDC says all of them are highly effective and at preventing COVID-19, and even more effective at preventing serious illness or death. And so what's the best vaccine? Whichever one you can get. So here's what we've been getting. And this is our first dose allocations. What I'll be talking about today are our first dose allocations. As a county, we have been getting a good supply of second dose allocations. Once we get that first one, the second one is pretty much guaranteed. So there hasn't been a problem for counties. There has been for our multi-county entities, our health providers. As you can see, we got our first allocation of Janssen, which is the Johnson & Johnson vaccine. We are receiving that as we speak. In fact, I spoke to Dr. Sandy Damiano this morning, and she has received 200 doses for the main jail and 200 doses for our CCC. And that's particularly beneficial there because of the high turnover. 72% of our jail population is out in 14 days. So scheduling a second appointment is really a challenge. So that's one of the populations we'd serve with that vaccine. We're also looking at it for homeless persons, farm workers, and those who are highly mobile or very difficult to access. So if we only have one chance, let's get them vaccinated with Johnson & Johnson. For the more stable populations, we'll use the Moderna and Pfizer.
Excuse me, Jim. Supervisor Kennedy has a question.
Yeah, why is it, or do we know that the statewide percentage for Sacramento County seems to be on a downward slope?
I'm glad you asked that. The state uses an allocation methodology. Actually, it's Blue Shield now that uses the allocation methodology and recommends to the State Department of Public Health what the allocation should be. Every 2 weeks, the governor changes his mind, and the allocation methodology changes, and it has not benefited Sacramento County. In fact, were it not for the Janssen vaccine, we would be at 13,990, which is the lowest since the January 25th. It just keeps going down and down. In 2 weeks, I think the vaccine supply is going to increase dramatically. Business Week just reported that the first 2 weeks of February, Pfizer was producing between 3 and 4 million doses per week. By next week or the week after, they should be up to 13 million. Johnson & Johnson, this is our first allocation. It may be a week or two before we get another one, maybe the end of the month. They are talking about a substantial increase then, maybe 100 million doses nationwide. So we could be very good shape by the end of the month. Right now we're tight. We're very glad to have gotten that Janssen supplement. Now, of course, this doesn't include our multi-county entities like Sutter Health. Now, this I'm talking about.
Excuse me. Were you done, Supervisor Kennedy?
Uh-oh.
I thought you were still asking.
I'm not done.
Okay.
Yeah. I mean, you're not moving. You're still continuing to answer the question.
Okay.
Yeah.
I'm sorry, I didn't.
Yeah, no worries.
He wasn't done.
Okay. Let me restate the question, because you in a very politic way, you explained that we are in the situation we're in. But my question was, why? You said that Sacramento County hasn't benefited from these decisions.
Well, if you look at the distribution, Fresno and Kern, with maybe 2/3 of the population of Sacramento County, are getting far more doses. That's because of the emphasis on farm workers.
Okay.
And there may be some.
So would an answer be because of the different tiers and so forth, and they have a higher number of those particular categories? That's why they're benefiting more than we are.
That's correct.
That's true.
Okay.
That's true.
Thank you.
So when we start emphasizing the inequitable distribution, where you probably saw the news reports that we're looking at the lowest of the equity profiles, and we have 11 zip codes in Sacramento County, 40% of the allocation will be going there.
Right.
We do not know how we fare statewide for that metric.
Right. Okay.
And so when it changes again, it's a matter of where we fall. So.
Okay. Thank you.
Okay, excuse me, Supervisor Cerna, and then Desmond.
Thank you, Chair. I'll be brief because I think you kind of acknowledged or answered some of my concern in addressing Supervisor Kennedy's concerns. But I just wanted to point out, Sacramento County is roughly 3.8% of the state's population, and yet when you see 1.65%, we're getting. I mean, I know that you can't simply say on a per capita basis, a simple per capita basis, we ought to be getting double. But it is distressing to think about how disproportional the percentage of vaccine distribution has been to date for a county that has twice the percentage population compared to the rest of the state, when it's it seems just so disproportional. And I understand the nuance really is in what you just said, has to do with the occupations, has to do with how the governor or the administration rolls out who is next in line, so to speak. But it's still very concerning to us because we're the ones that, and I know you know this, but I'm going to say it out loud again, we're the ones that have to interact with our constituents and do the sometimes very complicated explanation as to why they're not in line yet. So the more that we can, again, do our best to pay attention to the critical messaging and explanation, whether it's on our website or by other means, that's critically important, not just to keep, emails from coming to us or phone calls coming to us, but it's really so that people don't continue to have such angst over feeling like it's not going to be until October until they get their vaccine. I can't stress that enough. And when you see numbers like this, it just makes me that much more concerned that we're going to have a heck of a challenge in front of us to continue to, play catch up when it comes to critical messaging.
All right. Let me clarify. The percent of state total, I included that column to show you the decrease in our allocation. It should not be compared with overall state population because this does not include the allocations to multi-county entities or what CVS and Walgreens are doing. So it's not a fair comparison to compare it to our population because of those factors. But it's real clear that we have been getting fewer and fewer doses as a percent of the total. The statewide total has gone up dramatically and ours has decreased. Something wrong with that, but that's what we're playing with right now.
Excuse me, are you done, Supervisor?
I am, thank you.
Okay, Supervisor Desmond. Thank you.
Thank you, Madam Chair. Thank you for the presentation. I know you're in a difficult spot. I echo my colleague Supervisor Cerna and Supervisor Kennedy. I was looking at these numbers the same way, and that's very distressing. But even with your explanation, it's still distressing. Yes. And if the explanation from the state is that we're diverting more doses towards these counties that have a higher number of agricultural workers, I mean that's great. But we were already lagging behind other counties in the categories above food and ag workers, right? So that's, to me, and so I guess my follow-up question to that is, what are the communications like with the state public health and even our legislative delegation here in Sacramento County? I mean, is this being brought to them? Are they aware of how Sacramento County is lagging? And to me, it's a bit of an embarrassment for the state of California that the capital county is lagging behind all these other counties and is seeing such a persistent decrease in vaccine allocations.
2 weeks ago, your board directed us to prepare a letter to our legislative delegation explaining exactly that. We did that. It has been sent to them. Dr. Kasiri and I have been in direct contact with the leadership of the Department of Public Health and Blue Shield. And by the leadership, I mean their director and their regional vice president. So they know our names. And let me go on with my presentation. I'll give you a little more information on that.
And then one more thing, Jim, I know you're going to get to this. I look at the next slide about some of the multi-county partners that you have. And you mentioned that they're going to have some problems with some of the second doses they're getting. I think that you alluded to that. I really want to hear more about that because we are going to hear about that from our constituents because they don't make the distinction. They just, it's a constant effort, I think, to explain to constituents that, hey, the county only has so much control. So I'm going to really want to know more about that and how the state or those multi-county partners plan to address that issue.
I'm really glad you asked that.
Perfect segue. Thank you.
Great segue.
Thank you. Please proceed.
Yes.
I know you want to. You're trying to.
We're talking about first doses on this slide. I should have highlighted that, but we're talking first doses. Our multi-county entity partners aren't getting them. And as a matter of fact, you probably read in the Bee this morning, also noticed an article in the San Jose Mercury News on Saturday, discussions of the Sutter health issue. The San Jose paper's headline was, Sutter tries to overcome a shortage of doses. Bee says that Sutter canceled 21,000 appointments because of vaccine shortages. The healthcare provider still is not scheduling appointments for first doses, instead prioritizing getting shots to people awaiting second doses, a plan with which we agree. Sutter will get 30,000 doses next week, March 8th this week, allowing everyone awaiting a second dose a shot within 6 weeks of the first dose. And as I'm sure you're well aware, Pfizer recommends 3 weeks and Moderna 4 weeks. So I give an indication of the problems with supply for our MCEs.
I thought it was 2 weeks.
It's 3 weeks for Pfizer and 4 weeks for Moderna.
Weeks
Right?
for Moderna and 4 weeks for Pfizer.
So at any rate, in communicating with Blue Shield, this is a direct quote from the regional vice president to me. Dealing with these second dose shortages has resulted in a lower than preferred increase to the LHJ, the local health jurisdiction, directly. And that will likely be the case next week as well. Of course, next week we won't have the Janssen doses. There's hope on the horizon. Like I said, we've got more vaccine coming down the pike. I believe by the end of the month, we will be in far better shape. And who knows, one of these days, the allocation methodology will favor us. Dr. Kasiri.
Excuse me, Supervisor Desmond.
Just one quick follow-up. So if there's a 6 weeks delay, let me just anticipate this concern obviously coming in. What impact does that have on the effectiveness of the second dose?
It does not have an impact, and
Okay.
that is allowable by the CDC. But of course, again, as Supervisor Cerna mentioned, it's in the messaging, because when you're expecting to get your second dose at 4 weeks and you're told that you're going to have to delay and you may not know exactly when, it has created some anxiety. So we've been trying to respond to that and reassure people that they will get their second dose.
I would like to mention that Kaiser seems to be doing well. They're getting 20% of the statewide allocation right up front. As a matter of fact, yours truly was able to get vaccinated yesterday in South Sacramento. They've converted a large furniture store into a mass vaccination site and are pumping people through there.
Yeah, they're sending out notices.
So I just have a few points to add to that. I just wanted to acknowledge that March 5th marked 1 year since we declared a health emergency for COVID-19. And I just wanted to, again, think about all the people who have been impacted. We've had over 1,500 deaths. And so the families that have been impacted by that, we've heard many of the stories, and we know how devastating it has been. And we have close to 95,000 that have been reported as with COVID-19, many of them having ended up in the hospital with very severe disease. So just wanted to acknowledge the impact that COVID-19 has had on our community. And then, of course, with the health officer orders, the closures, and the calls we've gotten from businesses of individuals that are hurting because of the business closures, and just wanted to acknowledge that as well. I also want to acknowledge all the supervisors for the support from the beginning through the declaring the health emergency, through the different phases of the health officer orders, with all of the issues with testing, with allocating us the funding so that we were able to get additional staffing, as well as provide support to the community. I just wanted to acknowledge that and thank you. And also to thank all the staff and volunteers and the partners, such as the hospitals and the community-based agencies that have all been so willing to come alongside, work long hours, doing everything that they could. Even now with the vaccination, we're still getting emails of people saying, how can I help? I want to help. So just wanted to thank everyone, and also to acknowledge the place where we're at right now, with a light at the end of the tunnel, a real light this time, because with the vaccination, we know that we are going to be able to protect people. So we're working really hard on that. And as Jim Hutt mentioned, advocating as much as we can to get more doses and working with our partners. We're hoping that next presentation, we will be able to present to you the plan that we have for the equity measures. As Jim Hutt mentioned, there are 11 zip codes that were included that are supposed to get part of the allocation of the 40%. So we've been working with all of the hospitals and community-based agencies and starting the work for that. So I'd like to present a plan for you to see all the work that's going into it. And hopefully the next time we present, we'll have better news as far as the number of doses we're getting. So, but just wanted to acknowledge all of you and thank you for your support.
Thank you, Dr. Kasiri, and thank you for all of your hard work. I know we have ongoing conversations about several different things from several supervisors. So that we're working on. One that's pressing on my mind is the school waivers, which I know we're advocating for. And can you just for the benefit of our constituents, explain about the school waiver versus the new rules with the opening of the schools with the CDPH?
So there are a few processes that are in play. One of them is a waiver that was started actually back in November, where when we're still in the purple tier, if we got to a certain threshold, the schools were able to request, submit a waiver request and submit a protocol and a plan for how the measures that they were putting in place to provide a safe environment. And so we did that process for a while, and then we got to the red tier, and then we went back to the purple tier, and so we weren't able to continue with that. Also to point out that the waiver was only for K through 6th grade. And then in January, the state did update their guidance and change the threshold to 25 per 100,000, so higher than it was before. And then also at the same time, also introduced a new process, a safety review for schools that were in the process of active reopening in January. And so it was a confusing process that they set up, and I know that even in the health officer calls, there are a lot of questions about who would qualify and who would not. We did receive a request through that process through one of the school districts, and so we called the state to find out if our interpretation was correct, and the state did say that it can only be active reopening, and they have certain criteria in their guidance as to what they consider as active reopening. So it was very difficult, but we could not approve that the application that we had received through that process, and this was to be able to open 7th through 12th, because the state does say in their guidance that 7th through 12th cannot be reopened during the purple tier. So I know that that's been very difficult, because we've worked real closely with the school district and continue to work with them. We've worked with them to be able to open the 6th grade. I'm hoping that soon we'll be able to get into the red tier so that all the schools can open. But
so are you saying that there never was that consideration for 8 through 12? It was only up to 6th grade?
The waiver process is only up to 6th grade, but there was this specific process that the state created, a safety review for only specific situations. And as I mentioned,
they were hoping
for
an exception.
Exactly.
Okay. And I think there's some misunderstanding, and I'm hoping we can get some clarification, because between CSAC, which I brought it up at CSAC, and they clarified that the waiver is different than the regulation. There seems to be some disconnect between the three, and between the county, CSAC, and the state. So yes. Can you please help us clarify that with the state so that we're all on the same page? Because it seems like there are differing understandings of the waiver situation.
Yes, and I had emailed them several times, but I will email them again and ask that they send the email to all of us so that
Thank
we
you.
can clarify.
Appreciate it. Thanks, Doctor. Supervisor Cerna.
Thank you. Jim, I don't know if you're at the conclusion of your presentation or not, but since Dr. Kasseri, I think, rightfully brought up all the thanks and gratitude that our healthcare workers deserve, in the spirit of giving thanks, I want to acknowledge and thank Dr. Kasseri most recently for her willingness to work directly with WellSpace Health and Dr. Jonathan Porteous of WellSpace and Dr. Barra, the leadership with WellSpace, to see that the vaccination clinic that was operating at Grant Union High School in the north part of my district in the Del Paso Heights community, they were, was reported in the local media, they were facing closure for a lot of different reasons I won't go into, but I think what we saw happen last week is that even though we perhaps have different perspectives on the regulations affecting vaccine distribution or the protocols affecting vaccine distribution, we came together very quickly. I should say Dr. Kasseri did under her leadership to see that that vaccination site will continue to operate. So I wanted to again publicly express my thanks to you, Doctor. And then I also wanted to also acknowledge the fact that as we progress through understanding how vaccine distribution works and the challenges associated with that effort, we're encountering a lot of different unique partners. And one of those partners that I'm happy to acknowledge today is our Mexican consulate. Yes. Yes. Dr. Kasseri and I happened to be at the Mexican consulate yesterday with our Consul General, Liliana Ferrer, and had the opportunity to do a little speaking before the press, acknowledging Elica Health, which is another partner that's helping with vaccine distribution at that site. And this will actually be a site that is intended to not just help Sacramento County residents, but certainly the 24 county service area for the Mexican consulate in the north part of the state. So, hats off to you and to all of our public health professionals that are in the public sector, the private sector, in capacities of leadership, or those that are actually putting the needles in arms. Can't say enough about the good work that's being done, but it really, I think, has demonstrated to me a real strong focus on problem solving, because this certainly hasn't come without its difficulties and its challenges. So I just want to make mention of that. Thank you.
Thank you, Supervisor Cerna. Supervisor Desmond.
Yes, and let me underscore some of those comments. Dr. Kasseri, thank you. I mean, you certainly demonstrated such a genuine concern, first and foremost, for the victims of this terrible virus, the people who have had their lives affected by the economic implications and the businesses affected by it. And you've tried to balance all those competing interests, and certainly appreciate you navigating this so well, and like Supervisor Cerna said, working through these problems as they come up. And I want to acknowledge you and Supervisor Cerna for your efforts to keep the clinic open in Grant High School, where it's so desperately needed. And I think it's great that Elica is part of that partnership, and they'll be doing a clinic in my district, actually, at St. Philomene School, I think in a couple of weeks or so. So that's wonderful and so much needed. I had a question about now that the CDC has issued some additional guidance on what people who've been vaccinated can do. The question has come up from several of my constituents. Hey, are we going to get some guidance at the local level about, I've been vaccinated. My mother, who's in a skilled nursing facility or assisted living facility, has been vaccinated. When will I be able to see my loved one? So can you comment a little bit on that, or where do you think that's going to go, and when we'll get some guidance on that?
Sure. Thank you for bringing that up. Yes, the CDC recently released guidance that allows people who are fully vaccinated to be able to meet in certain situations if everybody is vaccinated without wearing a mask, but also to point out that in public, we are still recommending that people wear masks. As far as changing our guidance, we have to wait for the state, because the state has a masking order in the state order. So in order for us to be able to change our guidance, the state needs to change theirs because we're not allowed to be more lax than they are. They're fully aware of all of the questions that people are asking. So I'm hoping that that guidance will come soon. And also as far as the long-term care facilities, that they're changing their guidance for visitation as well to make it more possible for people families to be able to visit their loved ones. So we'll provide that as well. And I'm also very happy to report that the number of cases we're getting in the long-term care facilities has drastically reduced. So with our next presentation in a couple of weeks, that will be part of it to show you how that has progressed. And I think a lot of that is also because of the decision to start with vaccinating in the long-term care facilities. So I think that is great. And I know that a lot of families are looking forward to being able to reconnect because it's one of the areas that's been really, really hard is not being able to have that in-person connection.
Thank you, Dr. Kassiri.
Thank you, Supervisor Desmond. Supervisor Kennedy.
Before I do, are you done?
Yes.
Okay. Okay, appreciate that. We tend to interrupt. I guess Ann and I have talked about this, and I don't know what to do about it, but I'm going to just float a concern, not a concern, but something that we all face, I'm sure. And that's, I realize that there is a tremendous amount of uncertainty. Things change regularly at levels beyond us, and I get all that. And you guys are, being as flexible as you possibly can, as are all of us. But we must be considering sites already. Right now, the answer that we give for the most part is just to truncate what our answers are. I'm sure that other supervisors are similar, and that's when people say, when am I going to get vaccinated, and why am I not getting vaccinated soon enough, and why don't I know where I'm going to get vaccinated? And, it's because there's a shortage of vaccinations at the state and local and federal level and all that. But we must be considering, we must already have locations ready to go so that when those vaccinations come, we're not just waiting for them to come and then we're going to start. Is there any way that we could, without raising people's expectations unreasonably and with, managing those expectations, still let people know coming to a neighborhood near you and show, where we're going to be locating these once we do have availability? Because, I'll tell you, for example, and Dr. Kassiri and I have talked about the Pinnell Center. Now I find out the Pinnell Center is actually going to be one on Friday, which is great, but I didn't even know that. I just feel like I'm a little in the dark as far as where these are going to be. I know we can't say exactly when, but we can say when available. Does that make any sense?
It does, and my apologies that you didn't get that information quick enough. Part of it, we were waiting for confirmation on the vaccine. As we pointed out, since we get it on a weekly basis, sometimes it is difficult to know how much we're going to get and which clinics.
Understood, and that's why I'm not being critical of that. But working within those parameters of not knowing how many we're going to get, we still have to have an idea of those locations which we've already nailed down for when there's availability.
Yes, we'll provide that with the next update.
Okay.
Part of the delay also has been that we know a lot of the community leaders have wanted to be part of that decision making. So we're still in that process, but we will be able to give you some information for the next update. So
and the community leaders need to be, and I totally agree with that, and I welcome that, and I appreciate the fact that you're doing it. But I think everyone up here will tell you that nothing drives you more crazy than when a city council person calls you and tells you what's happening in your district. So that's.
I agree. So I'll take
again though
for that one.
When our partners, the MCEs, or even other entities set up a clinic, we don't always get advance notice.
Okay, and I would believe that. But when you do, if we could do just a little bit better in communicating.
Got it. Understood.
Thank you.
There's room for improvement, for sure.
Thank you.
I believe there are no directors in the queue, and this is the end of your presentation. And I want to thank you for your very consistent reports that come back and keep the lines of communication open. I think it's been tremendously better ever since you started doing this several months ago. It's been hard at times, but it's really helping us out in the districts. So I'm going to ask our Madam Clerk if we have any public comments on this item.
We do not have any comments.
Okay, and so that concludes our COVID report for today. Thank you very much. And I believe at this time we can adjourn to closed session, and we will return at 2 p.m. This meeting is adjourned.